Today I'll be performing my final practical exam. Here's my sheet with all the points that I need to hit. First we're going to start off with the spinal scapula. So spinal scapula is going to be the top here. We have bony that goes from the medial side to the lateral side. The lesser tuberosity we're going to identify by finding the biceps tendon, and we're going to rotate the arm to find the groove. The greater tuberosity is on the outer side, and the more anterior one is going to be the lesser tuberosity, right where my thumb is there. Ulnar groove, we're going to find the medial epicondyle. We're going to go just distal to it, and right into there is where the ulnar nerve sits, and that's where the ulnar groove is. The ulna, with a long bone along here, and then the triquetrum is going to be the third bone in the proximal row of the carpals, and then where my thumb was, and then the hook of the hamate is going to be the distal row fourth bone from the lateral side, and it's going to be the bony protuberance where my thumb is there. Now we'll move on to shoulder extension. Ready if you want to hop up. Can you do this way, right? Yes, head this way, please. We're going to perform shoulder extension. We're going to have the patient's shoulder just off the table. Their head's going to look to this side, like such, so it's out of the way. And the normal range for this is going to be 60 degrees. To perform this, my fulcrum will go over the acromion process. My stationary arm is going to follow the trunk of the body with parallel, and my moving arm is going to follow the shaft of the humerus, just as such. So the patient starts in 0. I'm going to ask the patient to extend their shoulder. Is that as far as you can go? And relax. This patient has a measurement of 40 degrees, and normal is 60 degrees. So that was active, and now I'm going to perform for passive. Starting position, go into it, relax. That's passive, and now resistive. We're going to go from the starting position. He's going to go into extension, match my resistance. Ready, go. Relax. All right, you can go back to the chair. So that was active, passive, and resistive range of motion for shoulder extension. Next, we're going to get into the manual muscle testing of the abductor digiti minimi. The abductor digiti minimi, the origin is going to be the flexor carpio-ulnaris as well as the pisiform. The insertion point is going to be the two slips at the base of the proximal phalanx of the fifth digit, as well as the ulnar border of the extensor expansion. The action is going to be abduction of the fifth digit, as well as assist in opposition of the fifth digit, and the assist of the flexion of the fifth metacarpal phalangeal joint. The nerve is going to be ulnar. To test this muscle, we have the patient as such. We're going to have the patient extend abduct their arm, their fingers, and I'm going to apply a forced adduction in, and you're going to try to hold the position. Ready, go. 5, relax. Patient is able to hold it for 5 seconds. They will get a 5 out of 5 on the manual muscle test. So that hits the origin, insertion, action, nerve. Perfect. Next, we're going to get into the special testing. If you want to rotate your chair to face me a little bit more. First test we have, this is a biceps load test, and this is testing for a slap lesion. A positive for this test is going to be report of pain when performing the test. Starting position is going to have the shoulder slightly horizontally abducted, elbows at a 90 degree, shoulders at a 90 degree as well. We're going to stabilize here and at the wrist, and I'm going to pull against, and they're going to try to hold that position. Ready, go. Relax. So again, I was pulling their elbow into extension while they were trying to hold the position of flexion. Did you feel any pain with that? This patient reports no pain. I would compare bilaterally, it's a negative. Again, the positive is going to be pain, and this is for a slap lesion. Valgus stress test of the first metacarpal phalangeal joint. I take their hand, I'm going to stabilize at the first metacarpal bone and the first proximal phalanx. I'm looking at the ulnar side of the metacarpal phalangeal joint, the first digit, and this is going to be testing for a ulnar ligament of the first metacarpal phalangeal joint spring. Positive for this test are going to be gapping compared bilaterally as well as pain while performing the test. I will apply a valgus force Do you feel any pain with that? This patient reports no pain. I would compare bilaterally. And again, this is for a ulnar ligament, first metacarpal phalangeal joint sprain. Wartensburg sign. Have the patient's palm on the table. You can face the table a little bit more. Makes it more comfortable. I'm going to passively abduct all the patient's fingers and spread them apart. I'm going to ask the patient to abduct their fingers together. Perfect. You relax and bring them back out. That's more of a reset at the end to ask them to abduct their fingers after they adduct. What this look is looking for, you're going to be looking at, you can relax. You're looking at the pinky. When the patient adducts, if the pinky trails behind, lags, or does not go back together, that's going to be a positive, and this is testing for an ulnar nerve pathology. And that concludes my final practical exam, Practcial.